You're listening to Body by Poly. I'm Dr. Alain Polynice, here to share what I've learned over 25 years in breast and body surgery. Real talk, honest recovery, and the truth behind lasting results. In this series, we're talking about possible complications following surgery, specifically plastic surgery. And in this case, we're going to talk about fever, or if you have a temperature postoperatively. Now, it's not uncommon to have a little bit of a rise in temperature right after surgery. That's pretty common. But day 3 or 4, if you have a fever, that could be an indication that there's something going on, a possible infection, especially if that rise in temperature is associated with other things like redness around the incision line or purulent drainage or actual pus. So what are the things to watch out for? Now, there's some things that are normal. So a little bit of warmth around the incision line or a little bit of redness just at the incision line can be normal. But if that redness is spreading, it's really warm to the touch, and especially if you monitor it on a daily basis and that it is spreading, you can take a picture of it every day, that's an indication of an ongoing infection that can lead to even a worse infection like sepsis. Another thing is if you had a breast surgery, for example, and there's redness that's really tender to the touch, or if there's significantly more swelling on one side than the other, that could be an indication of pretty significant infection. So in all my surgeries, I do cover patients with antibiotics during the surgery and after. But even with that, patients can develop infections. Sometimes a suture can get infected. But if it's treated immediately, that can take care of the problem. But if not, the infection can spread, especially if you have an implant. That can be a real emergency. So any warmth, redness, spreading redness, that's something that you would want to call your doctor, or if you can't reach them, call 911, because sometimes being admitted to the ER or the hospital, getting IV antibiotics is the solution to aggressively treat an ongoing infection. But sometimes something as simple as just removing a little infected suture, putting a little antibiotic dressing on it, can take care of the problem. So these things can happen after surgery. We do take all the precautions to prevent them from happening. But if you notice anything like that, it's definitely worth a call. Thanks for tuning in to Body by Poly. If you found this helpful, hit subscribe and follow along on YouTube, Apple Podcasts, or Spotify. See you next time.